Hi, my name is Erin Edwards, and today I will be talking about the influence of cognition on the relation between backward walking and falls in multiple sclerosis. So, to begin, multiple sclerosis, or MS, is a progressive neurologic disease associated with inflammation, demyelination, and axonal damage, which can lead to both motor and cognitive impairments. As a result, persons with MS are at an increased risk for falls, which represents a very serious public health concern for this population. One of the problems that we face in fall prevention is that the current clinical measures of fall risk, mainly relying upon forward walking speed and balance, are really limited in detecting subtle motor and cognitive impairments that could contribute to falls. So ultimately, the current fall risk measures face limitations in predictive validity and sensitivity for falls. Now, interestingly, published data from our lab shows that backward walking sensitively detects falls and is related to information processing speed in this population. However, while it's known that backward walking is a non-automatic motor skill that requires higher levels of cognition, it remains unknown to what extent cognitive function influences backward walking's ability to predict falls. Therefore, our study objective was to determine whether cognition influences the relation between backward walking and falls. Based on published preliminary data, we hypothesized that the relation between backward walking and falls is conditional upon an individual's processing speed. And a secondary hypothesis tested visual spatial memory. And we chose these domains because they're commonly impacted in MS. So really, this is that critical first step in developing a cognitive framework that supports the clinical utility of backward walking as a sensitive measure of fall risk. Now, we tested this hypothesis recruiting 38 individuals with MS, and in one session, we measured forward and backward walking, retrospective falls, and cognitive measures of information processing speed and visual spatial memory. Our tests of information processing speed and visual spatial memory were the symbol digit modality test and the brief visual spatial memory test, respectively. Happy to answer questions on the method details if anyone is curious. So to test the hypothesis that each cognitive domain moderated the relation between backward walking and falls, we used hierarchical regression that included an interaction term predicting the number of falls. So for each cognitive domain tested, we ran one model for forward walking and one model for backward. And covariates across all models included age and disease severity. And our results demonstrated that neither cognitive domains moderated the relation between backward walking and falls. So specifically, while backward walking, information processing speed, and covariates significantly predicted the number of falls, there was no evidence of moderation. And similar results were seen for visual spatial memory. So to conclude, the relation between backward walking and falls was not dependent upon a person's processing speed or their visual spatial memory. However, this isn't to say that these cognitive domains aren't associated with walking, but rather they're just not associated with falls in our limited sample. We also recognize that falls are a really multifactorial complex event. So there could be many factors in addition to cognition that may influence the relation between backward walking and falls. We also relied upon retrospective fall reports, which are subject to inaccuracy as you're asking the participants to recall how many times they've fallen within the last month. So this is subject to inaccuracy because there's a high prevalence of memory problems in the MS population. So we look forward to enhancing this research using wrist-worn activity sensors to prospectively report falls, and that could be that first step in establishing the predictive validity of backward walking as a fall risk marker in MS. We also plan to utilize MRI to understand contribution of motor and cognitive brain regions to backward walking performance, which ultimately this starts paving the way for more personalized fall prevention therapies. Thank you, and I'm happy to take questions.